So students, in today's lecture, we are going to study general principles of antimicrobial therapy. So this chapter is important because in future we will study chemotherapeutic agents. So before studying those agents, we must make our base. So going into detail of this chapter, we are studying this chapter from pharmacology, Lippincott. Now, as we have already discussed in our previous lecture that these chemotherapeutic agents basically take advantage of your biochemical differences. This biochemical difference from the bacteria or the other organism. Definitely we are eukaryotic and the bacteria are prokaryotics, and there is difference of biochemical nature, and these antimicrobial agents take advantage of this difference. So because of this difference, we have selective agents. We are those antimicrobial agents. We have those antibacterial agents which show selective toxicity towards the bacteria. So what these bacteria do? These bacteria will actually injure or kill the invading organisms. So because of this selective toxicity, we prefer these antimicrobial agents or these antibacterial agents. So we human beings have ability to tolerate these agents. But even then, we will say that these antimicrobial agents are not absolutely selective towards the bacteria. They may show some toxicity in human beings or human cells as well. So we say that these agents actually have toxicity that is relative rather than absolute. So they don't show absolute toxicity towards the bacteria. Even then, they have ability to show some effects in your cells as well. So probably they are showing these effects at higher doses. These are the questions we will discuss with the drugs when we will discuss the drugs, when we will discuss the chemotherapeutic agents. So selection of antimicrobial agents is very important. When you are going to select an antimicrobial agents against a particular disease, you must select it according to your organism, according to the organism that has targeted you. So selection of antimicrobial agent will depend on the organism's susceptibility, site of the infection, how you have to select the antimicrobial agent according to the organism. For example, if you are suffering from gram-negative bacteria, you have to select an antimicrobial agent that is also active against gram-negative. So in case of gram-negative infection, you can't give gram-positive antimicrobial agent to the patient. So then site of infection is also very important. If you are suffering from urinary tract infection, you will prefer the oral agents or the oral antibiotics. You will definitely not use the topical agents, the agents which are used on the skin. So patient factors are also very important. You will select the drug according to age of the patient. You will select the drug according to health condition of the patient. For example, if the patient is suffering from kidney or the liver disease, you will definitely not prefer those drugs which are mainly metabolized by the liver, which are mainly excreted by the kidneys. Then patient safety is also very important. So you will use those agents at those doses which are safe in that particular individual. Then cost of the therapy is also very important. You will prefer those drugs whose cost is less. You will try to use minimum number of the drugs as well. So before going into detail of the chapter, you must know that what is empiric therapy. Another name of empiric therapy is empirical therapy. Now, what is empirical therapy? This is the term which is composed of three main features. So the first feature is that in empiric therapy, there is a clever guess. You have an educated guess. Basically, this empiric therapy is based on your experience. So this is a therapy which you give to the patient according to your experience. This is the therapy, this is a drug. There is a drug treatment which you are giving to the patient before any confirmatory lab results. So this is a is the therapy which you are giving immediately to the patients. So the three main features of empirical therapy is that this is immediate treatment. Secondly, this is the treatment which is based on your experience. Thirdly, this is the therapy which you are giving to the patient before the final results, before the final laboratory results, before the complete information. So another name of empiric therapy is empirical therapy. Now, for giving any agent to the patient, you must know that the patient is suffering from which type of infection. Either this is gram positive, from the gram positive, or gram negative. Then other terms which you will encounter during the study is the negative culture. Now, what is negative culture? Basically, culture contains the number of organisms. Now, what is the pure culture? The pure culture is actually the culture which is containing a single group of the organisms. Pure culture is actually the subculture. Now, what is negative culture? Negative culture is the culture that do not contains the organisms. Okay. So if you have treated a culture or an individual with an antimicrobial agent, when you will test his culture in the lab, it will be devoid of the organisms. Now, this culture is actually the negative culture. Now, what are the ways by which you can identify the organisms? There are different ways which you have already studied in microbiology, that is by culturing technique, by using the microscopes, by cultivation, by detecting the microbial antigens, by the detection of the microbial RNA and DNA, by the detection of the host immune responses, by the type of the inflammatory agents that an individual is releasing, by the basis of the antibodies which an individual is releasing. So in empiric therapy, our main objective is to give immediate treatment to the patient. Okay, and this is the time when you have to give the best treatment on the basis of your guess, and this treatment must be a clever guess. For example, if you have a patient who is suffering from neutropenia, that is neutropenic patient, that is he has less number of neutrophils. It means these less of number of neutrophils may be due to mycobacteria, maybe he is suffering from TB, that may be due because the patient is suffering from hepatitis. So you will take history of the patient, then according to the history, you will suggest him the drug. Okay, you are suffering from hepatitis, you can take this drug. No, you are suffering from TB. So basic TB is the cause for this, then you have to take that drug. So meningitis, if the patient is suffering from meningitis, you have to investigate either this meningitis is because of viral infection or because of bacterial infection. Then according to the condition, you will give him the treatment. So